They do it horizontally, they want it 9 inches wide by 6 inches tall, and that will work for most people to be able to cover their mouth and their nose.
That was Shelley Murphy explaining the ideal dimensions for making a homemade cloth mask. The shortage of personal protective equipment is straining healthcare workers, and now the Center for Disease Control and Prevention recommends that everyone wear a face covering in public. So, she's making her own.
So when I'm going through thick material, I sometimes just have to go really slow. One thing they're reminding us is to tell people that even though the CDC has said this is okay to do, it's really better than nothing. It's not full protection.
Deborah Harrison is a registered nurse working in hospice care. Preparation is much more thorough than it already was. Gowns, gloves, and even protective booties are consistently being washed. Though the cloth masks are not as effective as surgical masks, they provide some extra reassurance for her and her patients.
So these masks are going to give me more flexibility in being able to have knowledge, knowing that they're clean in each and every time I need to wear them.
So that's really what this is for. It's not so much going to keep us from getting the germ. If we're exposed to it, these little cotton masks are not really going to help that much. But it's all part of, as we keep hearing, flatten the curve. And if we can keep from spreading it, if we happen to be carrying it and not knowing it, we will have done something worthwhile.
One of the main ways that the coronavirus travels is via water droplets that are expelled into the air when someone breathes out. This is why the CDC has recommended that people wear face coverings like this one in public, and this is how to wear it so that you are properly protecting yourself and others. Pull apart the ruching so that it covers your nose, your mouth, and under your chin, and this will stop those water droplets from spreading. Mold the top to your nose and the contours of your cheeks, and press the sides in, and of course make sure the elastics are behind your ears. While you're out, be sure to practice social distancing, and when you're home, remove the elastics and don't touch your face because you could get yourself sick that way. If it's a cloth one, throw it right in the washing machine. From Andover, I'm Mary Rose Saad. Be safe.